Good day, we are Group 1 of DSIMGTS and this is our case study for the COVID-19 vaccine.
More than a year later since the first case of the novel coronavirus or COVID-19 was confirmed in the Philippines. According to the Department of Health, a total number of 523,516 cases are reported as of January 30, 2021. With that, a total death toll is at 10,669 and the recovery cases at 475,904. Lowering the death toll and the spread of the virus will only be achieved once a large population of the world is immune from the virus. And according to Ritchie et al., the safest way to achieve this is through a vaccine. Vaccines have been used in the past to decrease the number of other infectious diseases, and in November of 2020, the Philippine government said that it is aiming to earn at least $1.5 billion to vaccinate an estimated number of 60 to 70 million citizens within the period of 3 to 5 years for the Philippines, resulting in vaccinating around 60% of the total population of the country. After delays in making deals with various pharmaceutical companies to acquire or pre-order COVID-19 vaccines for the Philippines, the national and local government have their respective plans for the procurement of the said vaccine. As of January 12, 2021, national and local governments have released their details for their COVID-19 vaccine acquisition projects, which will potentially be set within the first quarter of the year. Among the few international pharmaceutical and biotechnological companies that have already sealed deals to supply the vaccines are AstraZeneca from the United Kingdom, Sinovac from Biotech of China, and Covovax from Novavax, a United States-based biotechnology company. Various factors must be considered in determining the vaccines that will be administered to Filipinos, as different vaccines produced by different manufacturers have different efficacy levels and they have different effectivities in keeping people sick from the virus. Another factor that must be considered is the transportation-related logistics of the vaccine from the manufacturers into the country and the distribution of it to various cities and provinces, as the distribution and logistics have to be in strict conditions for the vaccine to be effective.
AstraZeneca is a UK-based global biopharmaceutical company propelled by science, innovation, and technology. Its purpose and mission is to push the boundaries of science in order to deliver life-changing medicines to millions of patients around the world. The company makes use of revolutionary technology that powers important drug discoveries, a number of which are breakthroughs in the pharmaceutical industry. With the many advancements in science and technology, AstraZeneca aims to discover ways to not only treat, but to prevent and even cure different types of illnesses. Through the utilization of data science and artificial intelligence in the research and development processes, the company is able to gather more data for treating different types of diseases, helping them to develop solutions more efficiently. The company introduced a vaccine against the coronavirus, and after the vaccine's third phase of trials, it has been confirmed to be effective against severe disease, hospitalization, and death caused by COVID-19. The vaccine has an efficacy rate of around 70% after receiving 2 doses. It also does not need to be stored at very low temperatures as compared to alternatives like Pfizer's and Moderna's. During the development of the vaccine, AstraZeneca made sure to take factors other than efficacy into consideration. These include the vaccine's safety, immunogenicity, duration of response, administration, and supply. In line with their goal of global sustainable healthcare, the company aims to guarantee the availability and accessibility of the vaccine to all. They ensure this by developing the vaccine in a way that is stable, easy to use, and distribute. Sinovac is a biopharmaceutical company based in China, whose mission is to supply top-quality vaccines that will eliminate human disease. The company concentrates highly on the research and development, manufacturing, and commercialization of human use and animal use vaccines. One of Sinovac's major divisions is the research and development sector. The company's strategy for achieving their goals include utilizing their experienced and well-organized research and development team as well as advanced technologies and innovative methods in order to develop vaccines that prevent and control the spread of new infectious diseases. Sinovac partners with the Chinese government in order to provide disease control and prevention services to locals. The company also collaborates with local and international universities and research institutes to help in the creation and development of vaccines. Sinovac's vaccine for SARS-CoV-2 has already undergone phase 3 of clinical trials and has proven a 50.4 efficacy rate after receiving 2 doses of the vaccine. Like AstraZeneca's, Sinovac's COVID-19 vaccine does not require extremely low temperatures for storage and transportation.
With this, the main problem in this case study is given the limited resources, which optimal vaccination and logistics strategy should the local government units of Metro Manila conduct and concretize to ensure an efficient vaccination program to combat COVID-19? There are also the following sub-questions. Firstly, which between the two companies, AstraZeneca and Sinovac, has the best or most optimal payoff considering the budget and population of the cities in Metro Manila? Secondly, what is the most optimal logistics plan for the inoculation of the vaccines across Metro Manila with minimal transportation costs and accurate distribution plans? Third, what is the cheaper option for properly storing the COVID-19 vaccines, buying or renting biomedical refrigerators in order to stay within the budget? And lastly, what is the minimum number of vaccine centers that each city must have to accommodate the different geographical areas of each city?
The objectives of the case are to determine which between the two manufacturers, specifically AstraZeneca or Sinovac, will give the most optimal payoff considering the factors of allocated budget and population per city of Metro Manila. Second is to identify the most optimal logistics strategy for the inoculation of vaccines across Metro Manila, minimizing transportation costs and selecting the most accurate distribution plans. Third is to determine whether buying or renting biomedical refrigerators for the storage of COVID-19 vaccines will incur minimum cost. And last but not the least is to determine the number of vaccine centers that each city must have in order to accommodate the different geographical areas of each city.
Furthermore, an additional assumption will be the prices for buying and renting biomedical refrigerators. Although AstraZeneca's vaccines may be stored in normal refrigerator temperature of 2 degrees to 8 degrees Celsius, they could only be safely stored at such temperature for only 6 months. Thus, it is more practical to utilize biomedical refrigerators right from the start to ensure the proper storage of the vaccines for a longer period of time, as it could not be certain that all vaccines may be administered within a time period of 6 months. Even so, the same case applies to Sinovac vaccines, as they could also be stored at the same temperature for the same time period as AstraZeneca vaccines. According to Quip suppliers, the prices for renting and buying biomedical refrigerators are as follows. So for the monthly rental rate, the average price would be $1,234, and for the purchase price, it would be $6,193, and this will be shown later in the analysis part. In line with the table as seen above, the limitation here is that biomedical equipment requires a request for quotations to determine a price. Therefore, only estimates of the product prices were obtained. However, as you can see, the prices shown above are based on actual laboratory freezer quotes submitted by Quip suppliers in the last year. Moreover, the prices of biomedical refrigerators greatly vary on the brand, model, and the condition, which is either new or used, options, features, and packages.
The first objective for this case study is to decide whether local government units in Metro Manila should order vaccines from Sinovac or from AstraZeneca. In doing this, the group identified it is a resource allocation problem with the research budget available per city. With Sinovac and AstraZeneca having different prices per order of vaccine, cities in Metro Manila then need to assess which company they should partner up with. A resource allocation problem is a nonlinear programming problem used in ultimately finding the optimal allocation of the fixed amount of resources, or in this case, the budget of each city in Metro Manila, as they have already allocated to purchasing the coronavirus vaccine. A total of 13 out of 16 cities in the National Capital Region, or NCR, have announced their varying budgets. Moreover, it is highly relevant to take each specific budget into consideration, for the prescribed vaccine may differ per area according to what they can afford. In the following models prepared for each city with a pre-approved budget, the objective is to maximize the number of total doses they may acquire considering their financial resources. The changing cells, or the number of vaccine orders, are multiplied by the number of doses per order, resulting in the maximum number of doses which a city can afford. The main constraint in every model is the research budget available for the 13 cities in Metro Manila that have declared their allocation for the coronavirus vaccine. It must also be considered that every order includes 2 separate doses of the coronavirus vaccine. Furthermore, the total number of doses are then divided by 2 due to the requirement of administering 2 vaccine shots per individual for complete immunity. Firstly, for Caloocan, their budget is at 125 million. With this, 204,918 orders are advised to be ordered from AstraZeneca because of its lower cost. From this, a total of 409,836 doses may be ordered, and when divided by 2 due to the requirement of 2 doses each person, a total of 204,918 people will be catered to. The same model is then used for the rest of the cities, therefore the same process is carried out using Solver in this resource allocation problem. For Makati, their current budget is at 1 billion. With this, they can have 3,278,688 doses and serve 1,639,344 people. For Mandaluyong, their budget is at 200 million. This gives 655,736 doses and serves 327,868 people. For Manila, their current budget is at 250 million. This gives 819,672 doses and serves 409,836 people. For Marikina, their budget is at 82,700,000. This gives 271,146 doses and serves 135,573 people. For Navotas, their budget is at 20 million. This gives 65,572 doses and serves a total of 32,786 people. Moving on to Parañaque, their current budget is at 250 million. This gives 819,672 doses and serves a total of 409,836 people. For Pasay, their budget is at 250 million, and this serves the same amount of doses, 819,672, and serves 409,836 people. Next, we have Pasig. Their current budget is at 300 million. This can afford 983,606 doses and serve a total of 491,803 people. Next up, we have Pateros. Their budget is at 20 million, and this can afford 65,572 doses and 32,786 people. For Quezon, their budget is at 1 billion, so this can afford 3,278,688 doses and cater to a total of 1,639,344 people. For the last 2 cities, we have San Juan with a current budget of 50 million, and they can afford 163,934 doses and serve a total of 81,967 people. And lastly, for Taguig, we have a budget of 1 billion, so they can afford 3,278,688 doses and cater to a total of 1,639,344 people. As displayed in the models presented, each city can administer different amounts of doses and can cater to a varying number of citizens based on what their allocated budget can provide for. The obtained results of the resource allocation models ultimately indicate that it is best for all 13 out of 16 cities in Metro Manila to purchase the coronavirus vaccine from AstraZeneca and not from Sinovac due to the large price difference between the 2 companies. Moreover, a larger number of doses may be administered to the public and a greater number of people will be catered to with accordance to the allocated budget per city.
Now moving on, given the current circumstances, the effectiveness of the COVID-19 vaccines is of utmost importance. That said, it is highly necessary to properly store the said vaccines in order to ensure that it remains effective until the time that it will be used. Standard refrigerators are not designed with the lock and temperature control features. However, biomedical refrigerators do have the said features as they are specifically designed to store special kinds of medicines, plasma products, and vaccines. Unlike simple freezers and refs, a biomedical refrigerator meets the temperature requirements for storing such biological samples as it could reach the farthest temperature condition below the freezing point for a long period of time. In fact, vaccines are required to be stored within a very specific temperature range, which may reach as low as minus 70 degrees Celsius. When vaccines are either too hot or too cold, their immunogenicity will be negatively affected. Thus, it highly risks the effectiveness of the vaccine and the well-being of the individual who is being administered. In simple terms, if vaccines are not stored at their proper temperature, then they become less effective and unsafe to use, which may only cause further problems for the Philippines' current situation. Be that as it may, local government units within Metro Manila must take into consideration having the proper resources available for storing the COVID-19 vaccines, such as biomedical refrigerators, which poses a problem as they are presented with the option of buying them or renting them. The goal of this model is to determine whether buying or renting 3 biomedical refrigerators for storing numerous COVID-19 vaccines incurs the most minimal cost, as they must use their COVID-19 vaccine budget wisely so as to take into account the limitations of their financial resources. In line with the third objective of the case study, this would be a buy or rent decision, which is somehow similar to a make or buy decision problem. But instead of looking for a break-even point, the group utilized this model in order to see which decision incurs fewer expenses. Also, in this model, it assumes that a biomedical refrigerator will be used for a year. Now, under the purchase unit cost, one could see that the buying price of one biomedical ref is $6,193, and on the other side, the rent unit cost for one biomedical ref is $1,234 per month, but again, considering the assumption that the ref would be used for a year, the group added up the cost of renting said products for 12 months, which reached a total of $14,808. In order to obtain the total cost of both options, which is highlighted in orange, the group multiplied the cells highlighted in blue, which are the costs to be incurred, with a cell highlighted in yellow, which is the number of biomedical refrigerators needed. After doing so, the total cost of purchasing 3 biomedical refrigerators is $18,579, while the total cost of renting said products is $44,424. This means that the buying option is $25,845 cheaper than the renting option. And when this amount is converted into Philippine peso, the difference between the buy or rent option is about 1,240,000 pesos. Even so, one could see in the line graph that the line of the rent option is evidently more costly than the purchase option. Having analyzed this, even if LGUs opt to purchase or rent more than 3 biomedical refrigerators, the buying option remains to be a less costly option. The ability to attain such biomedical refrigerators by paying the lowest possible expenses will not only aid the public in being safely vaccinated, but will also prevent LGUs from doing unnecessary spending.
One problem that cities may face is the delivery of the vaccines to their areas. One of the more reliable options for the delivery of the vaccines is the online courier service providers that are now operating around the country. Some of the big names in the online courier service industry include Transportify and Mr. Speedy. These are the 2 courier companies that the model will be using because these are some of the well-known courier companies in the industry. The goal of this transportation model is to determine the most cost-effective usage of the services of both Transportify and Mr. Speedy, and to determine the overall minimum transportation cost of the vaccine to each city while still delivering the number of orders that each city has made. The model contains data cells which include the transportation cost per order of 60,000 doses of the vaccine to each city. Moreover, one order size pertains to 60,000 doses of the vaccine. So, for example, Makati has an order size of 17. This means that a total of 1,020,000 doses of the vaccine is to be delivered to the city. The constraints of the model include the equal number of deliveries that both online courier service providers must handle and that all orders of each city must be met. The decision cells of the model are the number of orders that each online courier service provider will handle per city. Lastly, the objective cell of the model will calculate the overall minimum transportation cost for all cities. Other information includes the basis of the starting point, which is the city of Muntinlupa, where a confirmed warehouse is located. With the help of the solver function in Excel, the results now show that Transportify will handle the following orders: 17 orders for Makati City, 13 orders for the city of Manila, 13 orders for Quezon City, 10 orders for Caloocan City, and 1 order for Pasig City, for a total of 54 orders. While on the other hand, Mr. Speedy will handle the following orders: 6 orders for Pasig City, 5 orders for Pasay City, 3 orders for Parañaque City, 2 orders for the city of Navotas, 9 orders for Mandaluyong City, 7 orders for Marikina City, 2 orders for Pateros City, 4 orders for San Juan City, and 17 orders for Taguig City, for a total of 55 orders. All of the resulting orders handled by Transportify and Mr. Speedy will amount to the total overall minimum transportation cost of 96,019 pesos.
Given the data on how many vaccine doses and how many people each city can inoculate within the given budget set by their own districts, each district must now create a distribution or inoculation plan of administering the vaccines to its people that is most optimal and accurate, especially considering their resources and means available to distribute the vaccines effectively. With the objective given, each district must now choose between 2 plans on how to distribute their vaccines. Listed below are 2 possible distribution plans, specifically a gradual distribution plan that spaces out the inoculation of the vaccine over a year, and a compressed distribution plan that compresses the inoculation of the vaccine over a shorter time, or half of the gradual distribution plan. The gradual distribution plan would mean that the vaccines distributed slowly increase as months go by, while remaining consistent. On the other hand, the compressed distribution plan would have an all-in-one strategy wherein majority of the vaccines will be administered already in the first half of 6 months. To find the most optimal and accurate plan, the data used for the illustrations are the total number of people who will receive complete doses that fit within the city or district's budget, which have been found using the resource allocation problem, which has been mentioned before. The cities grouped by districts, such as the Northern, Southern, Eastern, and the Capital District. Excluded are also the data of the cities that have no deal signed with regard to their budget, and the goal in percent of how many each district aims to distribute per month, either in a gradual or in a compressed plan. With the use of the 3-month moving average forecasting, it would help determine the forecasted data and its corresponding errors using the margin between the actual and forecasted data. This would help the districts determine the most optimal, accurate, and effective distribution plan with the least errors. The forecasted data using the 3-month moving average and its corresponding errors will help determine if either of the 2 plans, using the data of the previous 3 months, is doable and accurate for the following periods. What is important to consider are the corresponding forecasting errors, for this helps determine if the forecast using the moving average method has a high or low number or possibilities of errors using its mean absolute deviation. The forecasted data can give the districts an idea regarding their distribution strategy to efficiently allocate its resources, or the vaccines, and manage their process of inoculating and distributing the vaccines efficiently. Looking at the forecasted distribution plan of both options, which are the gradual and compressed, it can be seen that the forecasting errors and mean absolute deviation for the compressed distribution plan are much higher than the gradually increasing plan. This MAD shows the accuracy and reliability of their distribution plan based on the previous 3 months' performance and comparing it with their actual data. This then determines their forecasting errors and its mean absolute deviation. It can be observed that in the gradual distribution plan of vaccines, there is less chances or possibilities of errors in the forecast, such as in Manila, 2,400 MAD for the gradual and 59,000 MAD for the compressed, since there is less of a deviation from one month to another. Thus, this being the more optimal, efficient, accurate, and realistic distribution plan that the district should use to encounter less errors. The gradual distribution plan that spaces out and strategically distributes their vaccine supply, compared to the compressed distribution plan that administers their vaccines in bigger batches over a shorter period of time, is the more optimal and accurate plan as there is less of a deviation between the actual and the forecasted data, as seen in the MAD and the forecasting errors. Having this allows for the districts to slowly and strategically administer the vaccines at a gradual pace that allows for less errors, as well as avoiding possible bumps in the road in the first few months, especially since the inoculation of the AstraZeneca vaccine is something that is new to the population, and this would need for careful planning and the consideration of the possible errors that may happen. The respective LGUs of each district must account for how much resources they have, such as the number of healthcare workers that can cater to n number of people in a span of 1 month, or the total capacity of over a month of how many can enter the healthcare facilities to have their vaccine, while still maintaining social distancing protocols. It is given that administering almost 70% of their supply in a span of 3 months in the compressed distribution plan is an ideal situation since it would mean that if people are vaccinated earlier or in a shorter amount of time, it would reduce the spread of the virus at an earlier date. However, we must consider if this plan to distribute the majority of its supply at earlier months is efficient. For example, in the Southern District, hospitals, healthcare centers, city halls, and the like would have to inoculate almost 620,000 people in a month, or 20,666 people a day, which is highly unlikely and irresponsible as social distancing protocols would be violated because it would need to contain a large amount of people in one place at a time. Furthermore, the increase in percent in the gradual distribution plan has a smaller to a larger percentage, as the first few months would be a trial or testing period of how efficient they can allocate their resources to determine if they could increase their contribution to a higher number in the following months. If the districts and its respective LGUs use the gradual distribution plan, less errors would occur, which means that it is likely to be more accurate and reliable to use, since the data and the forecasting errors of the 3-month moving average has less deviations and errors. The government may strategically and carefully allocate their other resources and important factors into consideration to allow for less mistakes and challenges to occur along the way. This would include such factors such as the number of healthcare workers and vaccinators that must be trained for the inoculation of the vaccine, the logistics plans of priority individuals, the site protocols for the containment of a large number of people, and much more. It is important for these LGUs to avoid possible errors for mishaps, such as the virus spreading more rapidly, to care for the welfare and health of their people. Thus, one of the alternative courses of action and the most optimal and reliable one for the government or LGUs to use in the plan of vaccinating the districts of Metro Manila is to use the gradual distribution plan. This calls for each local government unit and its district to strategically administer the vaccines in an albeit slower but a more organized, strategic, and well-thought-out distribution plan to achieve effectivity and efficiency in combating the virus.
The local government units across Metro Manila have made their own procurement and deals with various COVID-19 vaccine manufacturers. A number of cities and provinces have signed deals with Swedish pharmaceutical firm AstraZeneca. Now that the national government and local government units have secured COVID-19 vaccines for their constituents, another issue that must be addressed is how they will distribute and administer the vaccines to the public. More specifically, how the Department of Health and the LGUs will map out vaccination sites in their areas. Seeing that most cities in Metro Manila are subdivided into districts, zones, or barangays, the LGUs can use the administrative divisions of each city to create a plan as to how and where they must set up vaccination centers in. The LGUs can utilize a binary integer programming model to identify which geographical areas they will establish vaccination centers in. Since the problem that the LGUs face is a yes or no problem, or is a problem that is answerable by a yes or no decision, a binary integer programming model would be appropriate. For the case of setting up vaccination centers for a city located in Metro Manila, a pure BIP model will be used as the only choices available are all binary variables. In setting up the BIP model, the group assumes that it would be best to have at least one vaccination center for each geographical area, or at least have one center that is in an adjacent zone, district, or barangay. This is in order to efficiently accommodate as many residents given the limitations in some resources that each city may have. The decision city will identify the specific cities in Metro Manila that the group will create a BIP model for. The decision variables will be dependent on the total number of districts, zones, or barangays a specific city will have. And the consideration for setting up a vaccination center for a barangay is that it must have at least one center or have at least a center that is available at the adjacent barangay. For cities that are divided into zones or districts, the group assumes that having at least two for each district or zone or its adjacent area would be more appropriate and sufficient to accommodate more people in comparison to a barangay. In total, there are 10 cities that the group has created BIP models for, and the group utilized the political maps for each city to determine its geographical areas and to see which areas are adjacent to each other. Each city will have its own BIP model, and indicated in the table is only a summary of the number of decision variables each city will have and the interpretation of having a value of 1 or 0 for each decision variable. A result of 1 will entail that the geographical area should have a vaccination center, and having a result of 0 will mean that the geographical area will not have a vaccination center. To illustrate the process, we will move on to the next slide. To illustrate the process of creating the BIP model for each city, the model for Makati City will be used. As seen in the illustration presented, Makati is subdivided into 33 barangays, and the map shows the respective barangays that are present in Makati City. The objective is to find the minimum number of vaccination centers that each city must have. Thus, the objective function should be total vaccination center for city will be equal to the sum of the resulting binary variables for each barangay. Apart from this, the constraint is dependent on the minimum number of vaccination centers each geographical center must have access to. Presented in the slide is the BIP model for the city of Makati, and the list of barangays are listed at the left and top area of the table. The decision cells are represented by the yellow cells at the bottom of the table or at the bottom of the model, and these cells represent the barangays which will either have a vaccine center or not. This is represented by the binary variable of 1, which will entail that it would have a vaccine center, and a result in the decision variable of 0 will mean that the respective barangay will not have a vaccine center. Since the decision cells require binary variables as its results, the group has set the constraint to limit the decision variable cells to binary variables only. The other constraints set in the model are the minimum number of vaccine centers that are within the barangay or its adjacent barangay. This is represented in the rightmost area of the model, and these cells named as vaccine centers nearby have the equation of the sum product of the result of the binary variables in the decision cells, the barangay, and its adjacent ones based on the row that it is located in. the data cells marked with 1 under barangay nearby or the data cells at the center of the model entail that it is located in the barangay itself or the surrounding barangay located from it. This data will help in determining whether a barangay satisfies the constraint of the needed number of accessible vaccine centers to it. The total minimum number of barangays with vaccine centers for Makati City is 7, and the total is derived from getting the sum of the resulting binary variables from the decision cells. So this slide illustrates the solver parameters that we used in determining or in identifying the objective of the BIP model, which is the objective cell or the cell that is highlighted in orange. The constraints that we set is that the decision variables or the decision cells must be binary since this is a binary programming model. And the other constraint, as mentioned earlier, is the minimum number of vaccine centers that each barangay or each barangay and its adjacent barangay must have. According to the results of the binary integer programming model, the barangays that will have the vaccine centers for the city of Makati are the barangays of San Antonio, Magallanes, Bel Air, Post Proper North Side, Sembo, Pembo, and Tejeros. This will mean that the constituents of the said barangays will get their vaccines administered in the vaccine centers located in their barangays. Moreover, the constituents of the barangays that are adjacent to them will also be permitted to have their vaccinations administered there. The same model and interpretation are utilized for the other cities located in Metro Manila. However, the only difference lies with whether or not the city is divided into barangays or districts or zones. Nonetheless, the process and the formulation for each model are similar. The only difference is in the constraint that the cities will have. This will be dependent on how they are divided. As seen in the table presented in the slide, Parañaque City will have at least 4 vaccination centers, Muntinlupa with 3, Las Piñas with 5, Makati City with 7, Pasay City with 8, Manila City with 9, Pasig City with 8, Quezon City with 3, Navotas with 4, and the city of Valenzuela with 7 vaccination centers at the minimum. So to illustrate the difference for a city which is divided by district or by zone, we have here the city of Manila, and the number of vaccine centers that each district or zone will have must be at the very least to be 2. So this constraint is the constraint that is represented in the rightmost portion of the model once again, and the group made the minimums for the cities divided by districts or zones to have at least 2 vaccination centers because the area coverage of a district or a zone is wider in comparison to the area covered by a barangay. Identifying the minimum number of areas and the specific areas which will have the vaccination centers with the use of a binary integer programming model can be advantageous to the local government units. This can help them ensure that whichever location they will place their vaccination centers in is accessible to as many people as it can reach. Additionally, utilizing the given binary integer programming model will not result in vaccination centers that are in areas that are only concentrated in one certain geographical area of the city. This is the result of placing a constraint that at least each barangay or its adjacent barangay must have at least 1 vaccination center present.
The first course of action is to administer the Sinovac vaccine with the optimal distribution or logistics plan. Specifically, to buy biomedical refrigerators for storage of the vaccines, using the gradual distribution of vaccines plan for 12 months, having a limited number of barangays which will have vaccination centers, and having different courier services for delivering vaccines. The benefits or the pros of this ACA is that the biomedical refrigerators that are bought by each LGU to store the vaccines will be less costly compared to renting them. The use of the gradual distribution plan will have less possibility of errors and is more accurate and reliable, thus being more possible and optimal for the government to implement. It will also be less costly for each city if only there are few vaccination centers in each city. And the use of Transportify and Mr. Speedy will attain minimum cost as they handle different parts in Metro Manila, thus having the optimal transportation or delivery system. But, however, the disadvantages or costs of this is that less vaccines can be bought using each city's budget because the Sinovac vaccine is more expensive compared to AstraZeneca. Since the vaccination centers for each city are at a minimum, one vaccination center in a barangay will have to cater to more residents who are from adjacent barangays, thus further prolonging the vaccination process.
For the second alternative course of action, it is to administer the AstraZeneca vaccine with a less effective and somewhat efficient logistics plan. So with that being said, the vaccines to be purchased are from AstraZeneca, which is less expensive than Sinovac, thus creating a greater chance to purchase more doses to cater to more people. These vaccines are to be properly stored in biomedical refrigerators, which are to be rented by each local government unit within Metro Manila. In terms of the administration and inoculation of the vaccines, they are to be distributed within a more compressed time period of 6 months. Although the prompt timeline to vaccinate people as soon as possible may be considered ideal, it is also an unstrategic plan considering the fact that vaccinating thousands of people within a small space goes against the social distancing rules, which should actually be strictly complied with to prevent the risks of being infected with the virus. With that being said, it would be practical to put up vaccination centers in all barangays in order to distribute vaccines at a more efficient pace without worrying about the crowding of people within the center. However, this strategy would incur a bigger cost and it would possibly create an issue due to lack of manpower who are qualified to administer the vaccine, as well as the lack of facilities that could be turned into vaccination centers. Even so, to easily manage the transfers and delivery of the vaccines, only one courier service would be used by the local government units. In spite of the advantage of communicating with only one courier service, it would be more costly as prices vary from the starting point to the ending point of delivery, availability of drivers, and the prices of the service itself. For the group's third and final alternative course of action, it is to administer the AstraZeneca vaccine with the optimal distribution or logistics plan. In consideration of this, the vaccine that will be purchased will be from AstraZeneca since the company offers the vaccines at a much lower price than its competitors. Therefore, more doses are administered and more people will be catered to, and this is in accordance with the allocated budget per city. Furthermore, the gradual distribution will be administered in order to have a smoother flow of vaccines per city. The vaccines from AstraZeneca will be distributed over a course of 12 months. It is also advised for warehouses to buy biomedical refrigerators in order to store these vaccines. For renting biomedical refrigerators, for the storage of the vaccines may incur higher expenses. Finally, for the inoculation of the vaccine per city, the number of vaccination centers will only be located in a few barangays per city. Instead of having a vaccination center per barangay, the adjacent barangays may also be catered by the barangay with a vaccination center. This is done in order to minimize the overall cost of setting up vaccination centers. The delivery of the vaccines to each city will also be handled by different courier service to attain minimal cost using strategic and appropriate transportation or logistics plan.
In conclusion of this study, the group recommends that the third alternative course be implemented by the local government units of Metro Manila. AstraZeneca is the more optimal and beneficial choice between the two vaccine manufacturers. Considering the allocated budget and population of each city, it is recommended that 13 out of the 16 cities purchase their coronavirus vaccine supply from AstraZeneca. This company also provides the more cost-effective vaccine supply, which can provide for more than 7 million Filipinos in NCR. The AstraZeneca vaccine needs to be stored in standard refrigerators with temperatures ranging from 2 to 8 degrees Celsius and only within a period of 6 months. Relating to the gradual distribution plan of the AstraZeneca vaccines, storing them in standard refrigerators for 12 months would negatively affect its efficacy. Therefore, storing them in biomedical refrigerators from the start is the most effective and safe way to keep its immunogenicity intact. Given the requirement of needing biomedical refrigerators to properly store the vaccines, local government units need to acquire one for the respective vaccination centers. Comparing the total cost to be incurred between buying and renting said refrigerators, it would be most optimal to buy it. Renting biomedical refrigerators incur a higher amount of expenses, making buying the refrigerators the better option. The use of the 3-month moving average in forecasting the most optimal and reliable distribution plan may guide the cities or districts in creating their distribution strategy to efficiently allocate their resources and manage their processes of distributing the vaccines. After thorough analysis of both options for distribution, gradual and compressed, the gradually increasing distribution plan is more optimal and accurate through observation of its lower forecasting errors and mean absolute deviation. This allows for the districts to slowly and strategically administer the vaccines at a gradual pace that allows for less errors, avoiding potential mishaps in the first few months. If the districts and its respective LGUs use the gradual distribution plan, less errors would occur, making it likely to be more accurate and reliable to use, since the data and the forecasting errors of the 3-month moving average has less deviations and errors. The government may strategically and carefully allocate their other resources and important factors into consideration to allow for less mistakes and challenges to occur along the way. In utilizing a pure binary integer programming or BIP model, local government units will be able to identify the minimum total number of vaccination centers each distinct city must have. Apart from this, the BIP model helps to identify the specific barangays, districts, or zones. This ensures that the residents of the respective cities will have vaccine centers that are accessible to where they live, and that there are enough vaccination centers to accommodate the residents of a city. More importantly, with the use of the BIP model, LGUs can take into consideration the different limitations that they have with regards to limited resources and budget, possible venues for vaccination centers, manpower, and the costs they may incur in transporting the procured vaccines. Using this type of model, the LGUs will be able to efficiently determine where to place vaccine centers, as well as make other decisions. For instance, the final list of barangays, districts, or zones from their BIP model can be used to compute the costs they will incur in the transportation of the vaccines and the cost of setting up the centers. After comparing the different rates of each online courier service provider, namely Transportify and Mr. Speedy, it is best to follow the results thereof, or the best combination of availing of the services of these two courier service providers, in order to minimize the cost of the overall transportation cost of the vaccine to the respective cities.